Welcome to RJW News Health Updates. We are currently live here at Eurotel Station 2, Boracay. 135 passengers were allegedly landed here in Kalibo, Aklan, but were reported back to Wuhan, China. What is a coronavirus disease, and is there a coronavirus vaccine? A newly identified respiratory virus that causes pneumonia was recently discovered in China. Cases of the virus, a type of coronavirus, have spread in China and have also been reported in nearby Asia, prompting US health officials to start screening passengers coming from Wuhan, China to several airports in the United States. 2 patients in the US have been diagnosed with disease so far. The Centers of Disease Control and Prevention said, "What is a coronavirus? Coronaviruses are a group of viruses that can cause a range of symptoms, including a runny nose, cough, sore throat, and fever. Some are mild, such as the common cold, while others are more likely to lead to pneumonia. They're usually spread through direct contact with an infected person. The coronavirus gets its name from the crown-like spikes on its surface, according to CDC. Corona, by the way, is the Latin word for the crown. Including the newly identified form of the virus, there are a total of 7 coronaviruses that can infect humans. Other well-known coronaviruses include SARS and MERS. The new virus is called 2019 novel coronavirus. It's unclear how easily it spreads from person to person, but the CDC recommends that anyone who may have been exposed to the illness monitor themselves for 14 days after close contact with an infected person. Symptoms to watch for include fever, cough, shortness of breath, trouble in breathing, body aches, sore throat, or vomiting, and diarrhea. How does the new coronavirus spread? Researchers are still learning precisely how the virus spreads from person to person. While we do not know all of the mechanisms of spread of the epidemic so far, there is likely spread by droplets and contaminated surfaces, and possible airborne, similar to SARS. Coronaviruses in general are spread through close contact, a range of about 3 to 6 feet. The virus is primarily spread through a sick person coughing or sneezing on someone. A person could also become infected through contact with the virus particles on its surface, though it's unknown how long the new coronavirus can survive on surfaces outside of the body. If an infected person sneezes or coughs onto a surface, such as a countertop or doorknob, and another person touches that surface and then rubs his or her eyes or nose, for example, the latter may get sick. The SARS virus was also spread through feces. Denshin suggests that same spreading mechanism may be found in the new virus, but it's too early to know for sure. If you would ask, how long does it take for someone to get sick? The new coronavirus incubation period, meaning the time it takes from a person being infected with the virus to when they start showing symptoms, is still unknown. However, public health experts are working under the assumptions that the incubation period is about 14 days. It's unclear whether a person is contagious during the incubation period. If you will ask, does a face mask protect you from coronaviruses? The CDC recommends that patients with the coronavirus should wear a face mask to protect around them. Or if the patient cannot wear a mask, others should if they are in the same room together. Caregivers or people living in the same house as someone who is sick should also wear disposable face masks along with the gloves and disposable gowns when coming into contact with the patient's bodily fluids. For healthcare workers in contact with coronavirus patients, the CDC recommends a more specialized type of mask, one that is individually fitted to a person's face to create a seal that filters out 95% of particles. At this time, the size of the coronavirus particles is unknown. The SARS virus was 0.1 microns in diameter. How can I prevent coronavirus? One of the simplest prevention measures a person can take is proper hand washing. The CDC recommends washing hands with soap and water before eating, after using the bathroom, and after blowing your nose, coughing or sneezing, and before and after caring for a sick friend or a family member. The most effective way to clean hands is to wet them with clean water, then apply soap and scrub for at least 20 seconds before rinsing and drying with a clean towel. China to build a new hospital or facility which will cater the coronavirus patients. Construction has begun on one hospital with a capacity of 1,000 patients, which is expected to be finished in a matter of days. China's Wuhan city, the center of the outbreak of the new coronavirus, will build a second dedicated hospital to treat patients. Construction has already started on the first facility with enough space of 1,000 patients, which is expected to be completed by February 3. The second, which is designated to have 1,300 beds, is due to be finished within 3 weeks. This may seem like an unrealistic time frame. However, China has a history of quickly building hospitals at times of crisis. During the SARS outbreak in 2003, 7,000 people worked day and night in Beijing, taking just 7 days to build the Shaotangshan facility. It is believed to hold the world record for the fastest construction of a hospital and is thought to have treated 1/7 of China's SARS patients at the time. China's People's Daily newspaper called the building a miracle in the history of medicine. The outbreak of both the Wuhan coronavirus and SARS is believed to have been started in Chinese wet markets. Coronavirus spreading in China and the SARS outbreak of 2003 have two things in common. Both are from the coronavirus family. Second, both started in wet markets. At such markets, outdoor stalls are squeezed together to form narrow lanes, where locals and visitors shop for cuts of meat and dry produce. A stall selling hundreds of caged chickens may abat a butcher counter, where uncooked meat is chopped as nearby dogs watch hungrily. Vendors hawk skinned hares, while seafood stalls display glistening fish and shrimps. Wet markets put people and live and dead animals, dogs, chickens, pigs, snakes, civets, and more in constant close contact. That makes it easy for a virus to jump from one animal to human. On Wednesday, authorities in Wuhan, China, where the current outbreak started, banned the trade of live animals at wet markets. The specific market where the outbreak is believed to have begun, the Huanan Seafood Market, was shuttered on January 1. The coronavirus that merged there has so far killed 26 people and infected more than 900. Poorly regulated, live animal markets mixed with illegal wildlife trade offer a unique opportunity for viruses to spill over from wildlife hosts into the human population, the Wildlife Conservation Society said in a statement. Coronaviruses are zoonotic diseases, meaning they spread to people from animals. In the case of SARS, and likely this Wuhan coronavirus outbreak, as well as bats were the original hosts. The bat then infected other animals, which transmitted the virus to humans. Here's what Chinese wet markets look like. The Huanan Seafood Market is Wuhan closed on January 1 after it was found to be the most likely starting point for the outbreak of this coronavirus, also called the 2019 novel coronavirus. A 61-year-old man was the first person to die from the virus, according to Bloomberg. He was a regular shopper at the Huanan Wet Market, which sold more than seafood. Reports indicated that before the Huanan market closed, vendors there sold processed meats and live animals, including chickens, donkeys, sheep, pigs, foxes, badgers, bamboo rats, hedgehogs, and snakes. Wet markets like Huanan are common around China. They're called wet markets because vendors often slaughter animals in front of customers. That means there's a lot of skinning of dead animals in front of shoppers, and as a result, aerosolizing of all sorts of things, accordingly to Emily Langdon, an infectious disease specialist at the University of the Chicago Medicine. On Wednesday, Wuhan, China authorities banned the trade of live animals at wet markets. Police in Wuhan began conducting checks to enforce the rule among the city's 11 million residents, the BBC reported, citing state media reports. This type of intervention could help stop the spread of zoonotic viruses like the Wuhan coronavirus. Governments must recognize the global public health threats of zoonotic diseases. Christian Walzer, Executive Director of the Wildlife Conservation Society's Health Program, said in a statement, "It is time to close live animals markets that trade in the wildlife, strengthen efforts to combat trafficking of wild animals, and work to change dangerous wildlife consumption behaviors, especially in cities." The close proximity of shoppers to stall vendors and live and dead animals in wet markets make them prime breeding grounds for zoonotic diseases. Between 2002 and 2003, SARS killed 774 people across 29 countries. It originated in wet markets in the province of Guangdong. In the case of SARS, humans caught the virus from the weasel-like mammals called maxed palm civets. But the civets weren't the original host of the disease. Researchers figured out that SARS originally came from a population of bats in China's Yunnan province. Coronaviruses like SARS circulate in bats, and every so often they get introduced into the human population. Vincent Monster, a virologist at the Rocky Mountain Laboratories, told Business Insider. Bats can pass along viruses in their poop if they drop feces onto a piece of fruit that a civet can eat. The civet can become a disease carrier. Experts haven't yet confirmed the animal species that enabled the Wuhan coronavirus to spread to people. There's an indication that it's a bat virus spread in association with wet markets, Monster said. But accordingly to a group of scientists who edit the Journal of Medical Virology, the culprit in this case could be the Chinese cobra. Scientists in China have figured out the genetic code of the Wuhan coronavirus. When researchers compared it with other coronaviruses, they found it to be most similar to two bat coronavirus samples from China. But further analysis showed that the genetic building blocks of the Wuhan coronavirus more closely resembled that of snakes. According to the researchers, the only way to be sure of where the virus came from is to take DNA samples from animals sold at the Wuhan market and from wild snakes and bats in the area. The H7N9 and H5N9 bird flus, also zoonotic viruses, were likely transmitted to humans in wet markets too. According to the World Health Organization, people caught those bird flus via direct contact with infected poultry in China. The diseases killed 1,000 people globally. Bats and birds are considered reservoir species for viruses with pandemic potential, according to Bart Hagmans, a virologist at the Erasmus Medical Center of Rotterdam, Netherlands. Because these viruses have not been circulating in humans before, specific immunity to these viruses is absent in humans, Hagmans told Business Insider. There have been plenty of eminent epidemiologists predicting pandemic X for a number of years now. Adrian Heisler, the chief of medical officer at Helix International, told Business Insider. These pandemics are more likely to originate in the Far East because of the close contact with live animals and the density of the population. Heisler added, his firm offered risk management solutions for global travelers. The Wuhan coronavirus outbreak isn't considered a pandemic. However, since December 31, more than 900 cases of the Wuhan coronavirus have been reported across 10 countries, including the US. Symptoms include sore throats, headaches, and fevers, as well as pneumonia-like breathing difficulties. Hagman said one of the challenges in containing this outbreak was that a substantial portion of infected people show only mild symptoms. These people may go unnoticed in tracing the virus and fuel the outbreak, he said. It seems that this actually may be the case now. For more information about the coronavirus of Wuhan, China, everything we know about the deadly Wuhan virus sweeping across China, just refer to health expert issued an ominous warning about a coronavirus pandemic 3 months ago. Their simulations show it could kill 65 million people. Wuhan, China, and 5 other cities have been quarantined as China attempts to halt the spread of coronavirus. That's about 23 million people on lockdown. The Wuhan coronavirus has spread to at least 8 countries. Here's how to protect yourself while traveling. Experts think the Wuhan coronavirus jumped from bats to snake to people. Bats have been the source of at least 4 pandemics.